Hello, I'm Doug Binder from the Department of Emergency Medicine, and this is Kitty Foose. Kitty just graduated from the School of Medicine a little more than a week ago. How does that feel, Kitty?
Feels pretty great.
Yeah, I'll bet it does. Kitty and I are going to be simulating a patient interview. Kitty will be the patient, and I will be the medical student interviewer. And your job is to take notes and then to prepare an oral presentation for your learning community's mentor. I'm going to be using this checklist here from Doctoring 1A. It's a pretty good checklist. I'm going to deliberately leave out the allergies and medications as I go through the interview, and I'll show you how you can use this checklist to circle back to that information. Checklists are important in medicine. We use them all the time. And I suggest you start incorporating checklists into your clinical practice as soon as you can. All right, well, Kitty, are you ready to become a movie star?
I'm ready.
All right, let's get to it then.
Come in.
Hello, I'm Doug Binder. I use the pronouns he and him. I'm a medical student who's working with your team today. And I just want to make sure I have the correct information here. I have your name as Kitty Hefferhofer Kreffer Crofferstein with a date of birth March 1st, 1996. Is that right?
Yeah, you got the date of birth right, but it's actually Steen at the end, not Stein.
Ah, okay. Well, I'll make a note of that. And how would you like to be addressed by me?
Oh, Kitty is just fine.
Thank God for small favors. We have about 15 minutes together, and hopefully we can get to the bottom of your problem.
Yeah.
It says here that you're having some stomach pain.
Yeah.
Is that right?
Yeah, it is. It's came on a couple days ago, and at first I thought it was just, maybe food or something I ate, but it's really getting bad, and I thought I needed to come in.
Okay. Well, I'm glad you did.
Yeah.
Let's see if we can figure this out together. We're definitely going to talk about your stomach pain.
Great.
But
Yeah.
before we do, is there anything else that you want to talk about today?
Well, I haven't seen a doctor in a while. I think I might need a tetanus shot or something like that.
Okay. Well, we're definitely going to talk about the stomach pain. And I
Okay.
can check your records about the
Okay,
tetanus
yeah, that would be
shot.
great.
Yeah. Is there anything else you'd like to talk about during this visit?
Let's just focus on the stomach today.
Okay. All right. Well, tell me what's been going on.
Yeah, well, like I said, it started about 2 days ago. It kind of felt like indigestion, maybe right up here, and then it came and go. I could still go on with my life, and then, like I said, it just got real bad.
Okay. Let me ask you a few questions, and we can see if we can figure this out. Can you tell me a bit more about what's been going on here?
I mean, what do you want to know specifically?
Well, did it just stay there, or has it moved anywhere, for example?
Well, now that you mention it, it's really gotten lower, like maybe right here, and not so much of that burning heartburn pain, but real sharp now.
Okay. And on a scale of 1 to 10, where would you put that pain?
I'd say maybe, on the car ride over, it was pretty bad, maybe an 8. Sitting here,
Okay.
maybe a 6 or a 7.
Okay. Can you tell me a bit more about how it started and when it started and what it felt like at that time?
Yeah, so I'd say about, like I said, a few days ago, I wasn't doing anything in particular. I just noticed this pain. I didn't really eat dinner that night. I fed my kids dinner, but that was it. And then since then, it's sort of become more frequent, and the breaks without pain became shorter, and now it's sort of moved down over here.
Okay. Can you describe the pain in a little more detail?
Right now, when I hit that bump, it feels like somebody's really stabbing a knife in my side. Yeah, it's pretty sharp.
Okay. So how would you say it's affecting your life right now?
Well, I haven't been eating much. I've been pretty nauseous. When that pain comes on, it really knocks me out.
Okay.
Yeah.
All right. Well, all right. This is a little concerning. Let's see if we can figure this out together.
Sure.
Yeah. Let me just recap a bit. You say it started as an ache somewhere in the middle.
Yeah.
Right? And a couple of days ago, it's now moved to the lower right side. Is that right?
Yeah, that's right.
All right. And is it a constant pain, or does it come and go?
It's constant now. I think before it went away completely, and now it sort of goes, like I said, from real severe to maybe a moderate pain.
Okay. I'm sorry to hear that. It
Yeah,
sounds
thank you.
pretty bad. And you mentioned
Yeah.
that movement makes it worse, like the car bumps? And
Yeah, so I'm
Yeah.
sitting right here and it's okay, but if I try and
Okay.
lay down or anything, it really bothers me.
Okay, all right. So movement makes it worse. Does anything make it better?
I mean, sitting still,
Okay.
yeah.
Have you tried anything to make it better?
Not really. I mean, I've taken some ibuprofen,
Okay.
but with stomach things, I'm nervous to take any medications.
No, I understand. And is there anything else that goes on with this pain? For example, have you had any vomiting or diarrhea or anything like that?
No, none of that. I've been nauseous, but I haven't thrown up yet.
Okay. Any fevers or chills at all?
I didn't take my temperature.
Okay. But not that you've noticed?
Not that I've noticed, no.
All right.
Yeah.
Any changes with the urine that you've noticed?
No, maybe less, but I'm not drinking very much right now.
Okay. And what about your last menstrual period? When was that?
I'd say it was about 2 weeks ago.
Okay. And was that normal?
Yeah.
All right. And are you sexually active at this time? Is there any chance you might be pregnant, for example?
No chance of that right now.
Okay. So let me summarize what I've heard, and you tell me if it sounds right to you, and I'm just going to use my notes here. So you have a pain in the right lower part of your stomach,
Yeah,
which
right
is
here.
sharp,
Yeah.
pretty constant, started as a dull ache in the middle, which came and went, and then it moved to where it's now over the last couple of days.
Yeah.
Okay. And it's worse when you move. It makes you nauseous. You haven't been eating or drinking much over the past couple of days on account of this.
No.
And you've noticed no changes in your bowel habits or in your urine other than decreased urine frequency since it started. Does that sound about right?
That sounds about right, yeah.
Is there anything you'd like to add?
I mean, I'd just like to ask, I know this my mom said it might be appendicitis, which really made me worried. Is this what this is? Am I going to need to go to the hospital and have surgery?
Well, it's certainly, I mean, it's a little premature to say, but it's certainly a consideration.
Yeah.
And that's why I think we have to really try to figure this out. Now, remember, it's fine to use your checklist at this point to make sure that we've gone through all 7 dimensions of the HPI. I think we've done an okay job here. Not perfect, but an okay job. But feel free to consult this checklist. All right, let's switch gears
Yeah.
at this point. I'd like to ask you some questions about your past medical history and some other things, just to understand the situation a bit better.
Sure, yeah.
Okay. Do you have any medical problems that you're being treated for?
I have asthma.
Okay. So asthma. Now, there are a couple of very common medical conditions like asthma, diabetes, in which it's not enough just to say the patient has asthma, right? There are all sorts of gradations here. For example, does she have asthma where she just needs a puff of a metered dose inhaler every now and then? Or does she have asthma in which she requires frequent steroid bursts and she's been to the hospital multiple times, maybe even up to the intensive care unit on a ventilator? So you need to differentiate how serious this is and then to communicate that in the oral presentation as well. I see. Can you tell me a bit more about the asthma? How long have you had it and how is it treated?
Oh, I mean, I've had it since I was a kid. I've never really known my life without asthma. Nowadays, it's just when I exercise, I need maybe 1 or 2 puffs of albuterol. Is that what it's called?
Albuterol, right, okay.
Yeah.
I see. And have you ever gone to the hospital for your asthma?
Not recently. I think I was admitted once as a kid.
Oh, okay.
But I don't remember much about that.
Okay, fair enough. But not since then.
No.
All right. Do you have any other medical conditions?
No, that's it.
All right. Have you ever had to go to the hospital for anything else, or have you ever had to stay overnight in the hospital? And this is a pretty good screening question. For some reason, asking people if they've ever had to stay overnight in the hospital seems to jog their memories about things.
Yeah, now that you mention it, I broke my arm as a kid and I had to go to the hospital and get it casted. They kept me for a night because they thought I might need surgery, but I didn't.
Wow. When did this happen?
Oh, I was probably in middle school.
Okay, all right. And what was it that how did you break the arm? Or?
I mean, I was being a silly kid. I flew over the handlebars of my bike and broke it.
Oh, that's quite a story. Did you have any other injuries with that bike crash?
No, I was pretty lucky. I think it's just some bruises, scrapes, really just my arm took the
Okay.
brunt of it.
All right, fair enough. Any other surgeries or other hospitalizations? Or?
No.
No? Okay. I have a few questions about family and living
Sure.
situation. Are your parents still alive?
They are, yeah.
Okay. And do either of them have any medical conditions?
Not that I know of, very healthy.
All right. Any siblings?
No yes, I have a sister.
Okay. And is any medical conditions?
You know, I don't see her very often, so I don't know anything about her health.
Okay, fair enough. Any children?
No kids.
Okay. Now, I'm going to ask you some more personal questions about smoking and drinking. And I ask these questions of all my patients. Okay. So, do you smoke cigarettes?
No, I can't with my asthma.
Okay. Have you ever?
No.
All right. I can understand that with the asthma. And what about alcohol? About how many drinks would you say you have in a normal week?
I mean, I drink socially, so I'd say maybe 1 to 3 drinks per week.
Okay. Has there ever been a period of time in your life where you were drinking more than that?
College maybe, but no, I was never a serious drinker.
Okay. What about marijuana and other recreational drugs?
No, I mean, I tried it once, but again, with the asthma, it's hard.
I see. Okay. Tell me about your living situation.
Yeah, I live in a rental house with some friends.
Okay. And how is that?
Good, yeah.
All right. And how do you spend your days mostly?
I work as an office manager for a tech company here, and so I spend most of my days at work.
Okay. How is that for you?
Oh, it's fine. I mean, it's not something I want to do forever, but it pays the bills.
Okay, fair enough. What kind of a support network would you say that you have?
I'd say it's pretty strong. I mean, I have my friends and my parents, and I can lean on them when I need to.
Okay, well that's good to hear. I have just a few more questions for you. You mentioned that you're not sure about your tetanus shot status.
Yeah.
Okay, and I was wondering if you had received a flu shot or a COVID shot last year?
Yeah, I received both of those. I just don't have a doctor that I go to regularly, but I get my shots at Walgreens.
Ah, okay. So things like Pap smears and...
Yeah, I don't know when my last one of those was.
Okay. So would you be interested in having a regular doctor?
I would, yeah.
All right, we'll see what we can do about that. We can try to set you up. Now, I just have some questions about some other things that aren't really related to why you came in, but they're more of a general health survey.
Okay.
This is the review of systems, and this is exactly what it is. Just a health survey, a review, if you will. These questions are unrelated to why the patient came in. Things like, for example, she came in with abdominal pain. If we ask about vomiting, diarrhea, fevers and chills, those would be associated symptoms because they're associated with the complaint. But these are different. This is just a sort of a review of things. As you get more proficient in this history and physical exam process, you'll probably incorporate the review of systems as you go through the physical exam. In other words, when you're examining the eyes, you'll say if you had any visual problems, you're examining the ears, any problems with your hearing, things like that. But for now, I'd leave it separate. You have enough things to worry about right now. So have you had any changes in your vision that you're aware of?
No.
Any headaches of any sort?
No.
Okay. Any changes in your hearing?
No.
Okay. Any joint swellings?
No.
Skin rashes?
No.
Chest pains?
Oh, no.
Fast heart rate palpitations?
None of that.
New coughs?
No.
Shortness of breath? Anything?
No.
Okay. All right. Now, I'm just going to review my checklist here and
Sure.
see if I've left anything out.
Sure,
Okay?
yeah.
And let's see. Oh, I see that I didn't ask you about allergies and medications. Are you
Oh, yeah.
taking any medications?
Like I said, the albuterol. I maybe take that maybe 3 to 4 times a week.
Okay. Any other prescription medications?
No, just that one.
How about any over-the-counter medications like from the CVS or Walgreens? Or...
Ibuprofen occasionally.
All right. Any herbal supplements?
I take St. John's wort. Does that
Okay.
count?
Why are you taking that?
My friend said it's healthy, and so I take it to be healthy.
Okay, fair enough. Any allergies?
I think I'm allergic to penicillin.
Okay. Do you know what's supposed to happen when you take it?
I think I get a rash, maybe.
Is this something you were told from when you were little?
Yeah, apparently
Okay.
something happened as a baby.
All right. Any other allergies, either to medicines or other things?
Seasonal allergies.
Okay. All right. I'm going to talk to the head doctor now
Okay.
and about what's been going on, and we'll come in together and we'll do a physical examination at that time. And we might have to do some tests to figure this
Sure,
out,
yeah.
and that'll be up to her, and she'll be the one who'll talk to you about that. Is there anything else you'd like to tell me before I step out of the room?
I mean, do I need to plan to stay in the hospital tonight?
Let's wait for her to come in and we
Okay.
can have I'm just a medical student right now, but let's wait for her to come in and we can have that conversation.
Okay, thank you.
All righty. Well, thank you for talking with me, Kitty,
Thanks so much.
and I'll be back in just a little bit.
Thank you.